Welcome to COVID's Lasting Impact, Caring for Immigrant, Migrant, and Asylee Patients, a 10-episode mini-series within Migrant Clinician Network's On the Move podcast, a podcast dedicated to providers who work with vulnerable populations, specifically migrant populations. In this mini-series, MCN provides clinical teams, including community healthcare workers and primary care clinicians, with up-to-date information, expert guidance, resources, and relatable case stories for identifying, treating, and managing COVID and long COVID among U.S.-based immigrant, migrant, asylee, and limited English proficient patients in the outpatient setting. MCN is a national nonprofit with extensive experience providing timely, practical solutions at the intersection of vulnerability, migration, and health. Each episode provides clinicians with impactful tools and information for improving the quality of COVID care for vulnerable populations. If you want to hear future conversations on the topic of health justice, be sure to subscribe to the On the Move podcast. For resources mentioned in today's podcast, be sure to click on the link in our episode notes to go to our podcast page at migrantclinician.org/podcasts.
Welcome to today's podcast, Long COVID, Supporting Patients and Families. I'm Pamela Sakata Sales, Senior Program Manager at the Witness to Witness program at Migrant Clinicians Network. On today's podcast episode, we welcome back Dr. Kaethe Weingarten. We talk about the varied challenges patients and their families may face before, during, and after a long COVID diagnosis, and how clinicians can help vulnerable communities suffering from these impacts. Dr. Weingarten is a director of the Witness to Witness program. The goal of W2W is to help the helpers, primarily serving healthcare workers, attorneys, and journalists working with vulnerable populations. She received her doctorate from Harvard University and has taught at Wesley College and Harvard Medical School, where she was an associate clinical professor of psychology in the Department of Psychiatry at Children's Hospital Boston, and then Cambridge Health Alliance and at the Family Institute of Cambridge. She founded and directed the program in Families, Trauma, and Resilience at the Family Institute of Cambridge. She serves on the editorial boards of 5 journals. In 2002, she was awarded the highest honor of the American Family Therapy Academy, the Award for Distinguished Contribution to Family Theory and Practice. She has written about her work in 6 books, which she has authored or edited, and over 150 articles, chapters, and essays. Her most recent book, Common Shock, Witnessing Violence Every Day, How We Are Harmed, How We Can Heal, won the 2004 Nautilus Award for Social Change. Dr. Weingarten's work focuses on the development and dissemination of the witnessing model. Her work on reasonable hope has been widely cited. Welcome back, Kaethe. It's always a pleasure to have you.
Thank you. I'm actually really pleased to be able to talk about this topic.
Kaethe, your work during the COVID-19 pandemic has been incredibly impactful. Can you briefly describe the work you've been doing with COVID over the last year?
I have been focusing on trying to understand what other people understand about long COVID. It's really something that I think we were blindsided by 4 years ago, a little over 4 years now. The COVID pandemic, really was the dominant topic pretty much all over the world in the public health and medical communities. And people didn't really understand that there was going to be an aftermath, which now does have the name long COVID. And there's been a tremendous amount of very important, very significant research in the last year. And that's what my focus has been, trying to understand, frankly, what other people understand, because I'm not doing the bench science, other people are.
Thank you. That's very impressive. Now let's dive into our main topic. Can you explain briefly what long COVID is and how our understanding of it has changed in recent weeks?
Well, I would like to be able to do that. And I think the researchers and academics and clinicians would like to have one single definitive definition of long COVID. And the truth of the matter is we don't. A new study in the Annals of Internal Medicine reviewed 38 publications, and they had 5 definitions of long COVID. They conclude that, we really have to come up with a standardized definition that is going to cut through what at this moment in time is really a lot of confusion. So one of the ways that it's confusing is it's kind of like comparing apples to oranges. So one person's definition, one clinician's definition, even one researcher's definition might be different. So when you're looking at research studies, when you're looking at clinical studies, it's really hard to know whether you're doing a genuine, true comparison. So that's a start of an answer. Long COVID, kind of in a, let's say the most general way possible, is when people have had an acute COVID infection, whether that's been diagnosed with a test or not, but people are very clear that they had an acute infection. And then after a period of time, and this is one of the places where there's, there are differences in the definition, whether it's 12 weeks or 16 weeks or even more, symptoms linger. And I'm sure we're going to go into, what those symptoms are. But basically what we're talking about is people still feeling, let's say, not themselves following an acute COVID-19 infection.
Yes, it's fascinating how, our knowledge on long COVID and COVID just keeps on evolving. Can you explain how the physical symptoms of long COVID are linked with psychological and interpersonal impacts?
Yeah, so that will give me an opportunity, I think, to talk about like what are those symptoms. And here I would say what the researchers, the academic researchers talk about is quite a bit different from what a primary care doctor would be looking for or asking questions about for a patient. So first I'm going to talk about what researchers think is going on with long COVID. And the first thing I would say is that there seem to be many forms of long COVID. It's a multisystemic disease. It seems that it can affect almost all organ systems, but there seem to be primarily 6, let's say, underlying mechanisms that have been identified. And I'm going to go through those mechanisms because I think it's important in that each of these mechanisms seems to produce a different symptom cluster. And it's really the symptom cluster that your primary care doctor or a specialist is going to ask somebody about. So one mechanism is that the virus is persisting over a long period of time, and it can be reactivated under conditions which we still don't fully understand. Another mechanism is that long COVID, the experience has to do with the immune system being dysregulated. Another mechanism is that long COVID produces symptoms that have to do with an impairment in the way the gut and the brain communicate with each other. Another has to do with inflammation of the interior of your blood vessels, and that this can then produce microclots. Another is that there's inflammation in the immune cells and the microglia cells of the brain, producing inflammation in our neurons. And then the 6th hypothesis is that there is mitochondrial dysfunction, which impairs our metabolism. And that is the mechanism that most often seems to lead to the symptoms of fatigue. So those are the primary hypothesized mechanisms that produce the symptom picture. But now I want to say what a person would likely come to a physician about. So probably the two most dominant symptoms that people experience are fatigue and malaise after even very minor amount of physical or mental effort, and then also fatigue. There's another symptom that has a kind of a colloquial term, brain fog, where you just feel like you just can't think as clearly as you used to. Sometimes people feel dizzy. They have gastrointestinal or GI symptoms, heart palpitations, loss of smell and taste. Some people complain of a chronic cough, chest pain, and even abnormal movements of their limbs. So that's a set of symptoms that a physician is likely to inquire about if somebody is coming. What we find is that there's sort of a shorter way of thinking about, well, what are the long COVID symptoms as they impact family life and work life? And that list is a little bit shorter, and it's things like brain fog, the fatigue, trouble concentrating. People talk about kind of feeling like they can't organize their life anymore, that they have problems with memory, difficulty breathing, they feel depressed, they feel anxious, and that's tough for people.
That makes sense. The connection between our physical and our mental health is so crucial and so important, and something that we talk about quite often at Witness to Witness. I've also heard about you speak about concepts of self-loss and ambiguous loss. Can you explain what these are?
So if you think about what it would be like for somebody to have been completely active and vigorous in their life, get an acute COVID infection, say to themselves, okay, I'm not going to feel good for 7 to 10 days. It's not much worse than a common cold. And then they just don't feel better. And it drags on and on and on. And let's say that person is lethargic and tired and having, they go for a short bicycle ride and they come back and they're wrecked. They're really tired. What people say, or let me put it another way, when I talk about how those experiences make people have what I call an experience of self-loss, so many people go, yes, that's exactly what it feels like. So the specific definition is people who live with a painful gap between who they have been and who they are now are living with self-loss. They just don't feel like they used to feel, and it makes them really sad. They miss the person they felt themselves to be, and they no longer feel themselves to be. Now, the other concept that you mentioned, ambiguous loss, is totally related to that. Because if you're living with somebody and that person is there, but they are not the person they used to be, then you have a corresponding experience of ambiguous loss. So this is a very tough experience for families to go through.
Definitely. How might these impacts of long COVID affect migrant, immigrant, and asylee patients differently from the general populations in the United States?
So I think one of the biggest differences is that a lot of our immigrant and migrant populations are doing work that is difficult, challenging, physical work. And if you are exhausted, and if doing even a small amount of work makes you feel really sick, but you can't stop working because you're the sole support of your family, or you are just supporting yourself, and you don't have the option of saying, I'm going to take a week off or I'm going to take a month off, then obviously that symptom profile is going to be, it's going to affect your life, your work life, and your personal life, your family life, and your community life more than it would if you're somebody who can, let's say, work from home on a computer while you're lying down in bed. It's a very, very different experience. So that's one really important factor. The other is that many of the physical symptoms that I mentioned are ones that it would be, wise to have checked out by specialists. But many immigrants and migrants and asylum seekers don't have insurance. They might be able to go to an emergency room, but they're unlikely to be able to visit a specialist. And so, let's say, for instance, cardiovascular symptoms are not going to be evaluated. So their outcomes are likely to be worse than somebody who has insurance, or even a regular primary care doctor who's informed about how to evaluate and how to refer somebody who has any of the symptoms of long COVID I've mentioned.
These communities already face so many challenges as it is, and it's so crucial to address their unique needs. What are some ways clinicians can improve the experience of patients and families when they are coping with someone who is ill with long COVID?
Well, the first thing that I'm going to say is very, very simple, maybe even simplistic, but it's actually very significant and it does make a big difference. The first thing a clinician can do is empathize with patients and family members who are coping with long COVID. We know that especially before there was a lot of research done on this phenomenon of long COVID, many people were greeted with skepticism, like clinicians had never seen it before, and it just seemed kind of strange and odd, and often people were disbelieved. So understanding what patients and family members are saying and empathizing with just how difficult coping with long COVID is important. The second is to know your state policies with regard to workmen's compensation. I think that's really very important. And then this is perhaps something that, I'll talk about again, but it is the case that vaccination does seem to decrease the incidence of long COVID. But many of the patients in the group that our clinicians work with do not have access to vaccinations, or they were in communities where vaccination was seen as highly problematic and not something for people to seek out. And so now that we know that vaccination can significantly reduce the incidence of long COVID, it's important for a clinician to both suggest that their patients vaccinate and at the same time be really careful not to shame them for not having gotten vaccinated.
Thank you, Kaethe. Those suggestions were not only practical but compassionate, and I think those type of approaches can definitely make a significant difference. Thank you, Kaethe, for shedding light on such crucial aspects of long COVID, from understanding its evolving nature to the profound psychosocial impacts, and showing us how vital it is to support patients and families coping with long COVID. Your insights are always greatly appreciated.
Thank you. As ever, I'm really delighted to be able to share the information I do have. Thanks, Pam, and thanks, MCN.
You can reach both Kaethe and myself through the W2W webpage, as well as by emailing us at w2w@migrantclinician.org. W2W has an abundance of resources on the topic of witnessing and emotional health for clinicians serving vulnerable communities. The W2W webpage will be linked in the notes section of this episode. This fall, Witness to Witness is planning on hosting an anti-rhetoric webinar series on the power of words. Be sure to watch our webpage or sign up for our email list. For more expert guidance and tools to improve the quality of COVID care for vulnerable populations, follow our podcast On the Move with MCN and come back and listen.
To access resources mentioned in today's podcast, click on the link in our notes section to go to our podcast page at migrantclinician.org/podcasts. Visit migrantclinician.org/sign up to join our email list and subscribe to our blog to get updates on new MCN podcasts, resources, and webinars. Migrant Clinicians Network is a national nonprofit dedicated to providing practical solutions at the intersection of vulnerability, migration, and health. We offer technical assistance, health provider capacity building, resource development, research and data and evaluation support, and virtual case management for mobile populations, and free resources and training. The information in this podcast is for trained healthcare professional education only. Information should only be used in combination with up-to-date national and international guidelines. The information is not to be used as healthcare advice for the general public.